Hi, my name is Mackenzie Parrott, and this is my presentation on Welfel's decision-making model um, about the case of pills, chills, but no thrills. Why do we need ethical decision-making models, first of all? We need them for our client welfare. Ethical decision-making prioritizes the welfare of clients and ensures their best interests are at the forefront. We need it for trust and accountability. Um, our ethical decision making fosters trust, accountability, and reinforces the therapeutic relationship between clients and clinicians. And we need it for our professional standards. It's important because adhering to ethical principles upholds professional standards guiding clinicians in their practice and ensuring quality care. Case study: pills, chills, but no thrills. In this study, our client, Mr. Lilly, is a long-term client of Dr. Jansen. They've been struggling with money, and in a session, Mr. Lilly admits to selling his prescription medication to his friends and family. These medications are controlled substances: Adderall, medical marijuana, and Ambien. He says he does not sell his Adderall and Ambien very often, but he often sells his medical marijuana, uses his card for that. He says that his medical marijuana card was obtained outside of his PA's knowledge. Um, and we have to look at the legal and the clinical issues attached. What does Welfel's decision-making model, a tool for ethical decisions, look like? The first step is to be sensitive to the moral dimensions of counseling. Define dilemmas and options. What is the situation? Define the central issues and options. Refer to your professional organization's code of ethics. Search out ethical scholarship. What does the literature say? Consult with a supervisor and colleagues. Deliberate and decide what are you going to do. Inform your supervisor and document it. And reflect on the experience. So in step one of pills, chills, but no thrills, we have to look at the moral dimensions of counseling, which means that we need to become aware of how our own biases, principles, values, and worldview may influence the decision-making process. In this case, it seems Dr. Jansen is concerned about the legal issues. We have to take into account the long therapeutic relationship, the potential harm to others, the confidentiality versus legal, and her own responsibility as a clinician. In step two, we have to define dilemmas and options. The situation is that the client is selling their prescription medication to friends and family. The client is Mr. Lilly. He is a long-term therapeutic client. He's selling his prescription meds and he disclosed this voluntarily. The stakeholders are the client, Dr. Jansen, his PA, and the buyers of his prescription medications. Cultural considerations are that selling prescription medication is illegal. Medical marijuana may be legal in some states, but selling it is not. All right, so in step three, we're going to look at the issues, the ethically defined issues. We've got confidentiality, non-maleficence, fidelity, beneficence, justice, and professional responsibility. Our options are we could report Mr. Lilly to the authorities, do nothing, keep confidentiality, and ignore. We could terminate treatment, we could refer out, or we could convince Mr. Lilly to stop, change his behavior, and or turn himself in. Step four, we examine the relevant laws and regulations. And I have a list here of regulations from the ACA Code of Ethics, along with it's a criminal offense to sell drugs. So that would be a legal code. Step 5, we search out ethical scholarship. So in ethics literature supports that therapists should not report crimes unless mandated by law or there is foreseeable harm. However, avoiding the issue in therapy is unethical. So we need to rely on exploration, referral, and clinical judgment, as well as supervision. All right, so step 6 is consult with supervisors and colleagues. While doing this, it's important to maintain confidentiality. In this case, we could seek legal counsel due to the selling of the prescription drugs. We would seek counsel with our supervisor, maybe the state licensing board, and our colleagues. But no matter where we seek counsel, it's important to document it. Step 7, deliberate and decide. So this is when we consider our previously listed options, referral, termination of treatment, ignore it and say nothing, um, report the client to the authorities, or address the situation in treatment and ask Mr. Lilly to change behavior or turn himself in. So we have to identify our competing values, and in this situation, the competing values are confidentiality versus public safety, beneficence and non-maleficence versus autonomy, integrity versus avoidance, and trust versus legal and ethical responsibility. It's important to remember when making this decision to incorporate ethical courage. So the decision that I came down to was that we would address the issue, encourage Mr. Lilly to change, and encourage disclosure with his PA about his medical marijuana card, and only breach confidentiality if there is imminent harm. This solution promotes autonomy, confidentiality, and clinical integrity. In step 8, we inform our supervisor and document. So it's important to discuss your plan with your supervisor prior to implementing that plan. And then, of course, it is important to document everything. 9 is reflect on the experience. Um, this list was pulled from the sheet that we got breaking down Welfel's ethical decision making process. It says experience without reflection is wasted via Welfel. These are the questions that I can reflect on once I have implemented the plan. So, did I act timely? Was I educated enough about ethical codes? What ethical resources should I have available to me? Did I utilize constellation effectively? Did I actively identify my competing values? Would I have done anything differently? What did I do that I liked, and how can I pay it forward? Reflection is extremely important in order to continue to grow in understanding and effectiveness as a counselor, and to also be able to help future colleagues or future supervisees. This is my list of references. And yeah, and I appreciate your time. Thank you.